Hello today. We're going to talk about Chapter 7, dealing with attention deficit disorder and attention deficit hyperactivity disorder. Our verse for today, children obey your parents in the Lord, for this is right. Ephesians 6:1. Of course, children who have conditions like attention deficit hyperactivity disorder or attention deficit disorder do not necessarily want to disobey their parents, but they have a lot of difficulties with impulse control. Lack of impulse control. If you look at this funny little video clip, you'll get an idea of what I'm talking about. Watch it now. How do we qualify a child for a special education class for children who have ADD or ADHD? Well, many times you'll have a child who has a learning disability or who has a behavior disorder or emotional disorder, or even some children who are intellectually disabled, and they may also have ADD or ADHD. So if that's the case, the child is classified under what is considered their primary category of disability, like LD, ED, what have you. And then ADD or ADHD is written down as a secondary qualifying condition. However, there are some children who have no other special education need, but they do have ADD or ADHD, and it is so severe that it is keeping the child from functioning on grade level. Now, there are plenty of people who have trouble paying attention at times, or who have mild ADD or ADHD, and they don't really need to be in special education, and they don't even need medication. But what we're talking about are children who have such short attention spans that they can scarcely get anything completed in the classroom. Those are the children who might be classified as being a special ed student and who may be able to receive some help, such as going to a resource class, okay? And on slide 5, you see some of the other conditions. One thing we do know is that in most children who have moderate to severe ADD or ADHD, the frontal cortex of the brain, that's the front part of your brain, is usually underdeveloped. And of course, just so you'll know, the frontal cortex of the brain, sometimes also called prefrontal cortex, is not fully developed in many, many people until they're about age 25. That's why you see so many people who make decisions without really thinking through the consequences. And because of that, the child may have poor social skills because they just sort of jump out and do things without really thinking about it. Someone can have a low, an average, above average, or genius IQ and have ADD or ADHD. Okay, let's look now at just ADD on slide 6, attention deficit disorder. For most of those children, they have the characteristics that you see here. Inability to stay on task, they have a hard time concentrating or responding to questions in class. It's you ask a question and call the child's name, and they look at you like, huh? What? What did you say? What did he say? They really don't get it. They don't pay attention enough to follow what's going on, especially in a lecture mode. They also have a lot of trouble completing written assignments in class and will often forget procedures or steps and doing something like solving a math problem. So a good thing for a teacher to do would be to have the steps for a math problem written out or shown up on the whiteboard, or have a poster in the room so that as children are learning those steps, they can refer to that. And the child will be more likely to get things right if he or she can just follow along and know that this is how I do long division. This is my first step. This is my second step, and so forth. Again, requirements for children to qualify for special education help are shown next on slide 7. Child must have had these kind of characteristics for at least 6 months, probably before age 7 years old, and it is a medical diagnosis. With ADHD, it's the same thing, attention deficit hyperactivity disorder, but the child has that additional issue of movement. The child has to be moving a lot more, and you'll see adults who just cannot sit still. They have to always shake a leg as they're sitting there, or always be doing something with their hands. I know someone who has to sit and knit or do something all the time, or she starts to shake and rock. But the children just kind of seem like a car engine. It's like they're always running. They're always out of their seats. They're getting called down for doing things, impulsively touching others, bothering others, taking things that don't belong to them, carrying them around the room, and then the children in the classroom are complaining or fussing all the time. She's taking my stuff, she touched me, she's doing this, she's doing that, and a lot of complaints will come up. On the next slide, you see Noisy Nick there. A lot of children with ADHD, again, they need to make noise, either sounds or just get up and move around in the classroom a lot. This is another one, limited ability to deal with delayed gratification. What that means is, okay, now you've told me if I'm good all week, I'll get a prize on Friday. Well, I can't wait until Friday to get a reward. That's too far away to me and seems almost impossible if I have ADHD. Therefore, sometimes you have to do things to help get this child focused and to realize that, okay, if I do not get out of my seat more than 5 times this morning without permission, I can sit by my friend at lunch. Now, that would be a simple example of something you could do. Or you might do something like put a Post-it note on the child's desk every day, and whenever they're out of the seat at an inappropriate time, you put a little mark on it. And the child knows, if I get 5 marks before 11 o'clock, I don't get to sit by my friend at lunch. And that's just an example, again, of something that you could do. Children a lot of times are off task, doing things they shouldn't be, have to have frequent reminders of what he or she should be doing now. What are some of the things that really help children with ADHD? Structure. Knowing this is my schedule for the day, this is what's going to happen, and being pretty consistent with classroom discipline and rules and really just all the things that you do during the day. Teachers need to be able to, and this is one of my favorite quotes, inspect what you expect. If I've told you that I want you to have your homework in the basket every morning before the first class really starts, then you need to look and remind that child sometimes until they really get it. Or have another student remind the child, take the burden off you, and say, now when you turn your homework in, Susie, make sure you see that Becky's got her homework turned in also. Be specific about what it is you want the child to do, and again, visual clues are great. Visual cues can really help a child. Things like role playing, working on time management, helping a child realize, okay, this is due Friday, so that means today you need to write the first paragraph of your story. Tomorrow you need to write the second paragraph. Wednesday write the third paragraph. And Thursday you're going to proofread it all. And then Friday you're going to do the final copy in your best handwriting. That's just one example. But learning how to do things within a time limit. Also, sometimes behavioral support is needed. Sometimes if there's a helper, volunteer, teaching assistant in the room, that person can sit next to the child and make sure, especially young children, making sure they're staying on the right page and keeping up with what's going on. What about medication? You hear this a lot. Parents would come to me when I was a special ed teacher or special ed director, and they would say, I've heard about these medicines, and they're supposed to help a child focus and calm down, and I really think that would maybe something I need to do. What do you think? Well, in spite of the fact that I had many years of experience in public school and in special education, I never once told a parent, yes, your child needs to be on medication, or suggested to a parent that they need to go to the doctor and get their child put on some kind of drugs to calm him or her down. Because if you do that, you can be liable. That means legally you can be held responsible for anything that might happen in regards to that, or the parent can demand that the school pay for the medication. Your principal will not be happy if you do that. If a parent asks you questions about medications for a child who's ADD or ADHD, you might want to think about responding kind of the way I have through the years. A parent asks me and I say, well, I've seen some children that helps and some it didn't. You really need to talk to your child's pediatrician about that. Then the parent might say, oh, come on, I know you know if it's good or not. You're a teacher. You see these things all the time. What do you think? Well, then I go into the broke record routine, as it's known. And I would just say, I'm not a medical doctor. You just really need to talk to your child's doctor about that and let them know what's going on in school. And here's a little checklist of some things about your child's behavior that you could show the doctor. And you can decide along with that professional person. That's really not something for me to say. That way you absolve yourself of being considered suggesting someone's child is put on medication, which can actually offend some people. And remember, medication does not help every child. There are some side effects. Child may be sleepy, child may lose weight, because most of those medications are appetite suppressants. The child just won't want to eat, and I've seen that happen numerous times. If the child's been given a little bit too much of the medicines, a little bit high of a dose, the child may be sleepy, may be irritable, and some other things can happen. So we don't want to suggest those things to parents. What are some of the medicines? Some of these are still given: Ritalin, Adderall, Concerta, and there's a bunch of others now. The effects of the medicines may last from 4 hours up to 24 hours. Now they're tending to go more the 12 to 24 hour route, so that the child will be medicated when they're somewhere like church, where they have to sit for a long time, or school. These medications in general are not addictive, and they're out of the body within 24 hours. They'll be flushed out. If the person really does have ADD or ADHD. There have been a lot of cases, though, of people who don't have it but who abuse drugs, particularly Ritalin is one of the ones through the years that's been abused a lot. And then you can have side effects that are not good. So this medication is not for everyone. And I'll give you my opinion. I think a lot of times the medicine is not needed. I think it is way overprescribed. And again, this is my personal opinion. But when I go into an elementary school that has, let's say, 600 children, and I go to the school nurse and I say, tell me roughly how many children in this school are on medication for ADD or ADHD. And the nurse says, oh, I see about 75 a day out of 600. That is outrageous. It really is wrong. And we should not just turn to medication because we think it's going to help a child behave better. In many cases, children just need to be taught, and the parents need to be taught ways to work with the child so that the child can learn to manage his or her behavior. However, my caveat to that is I have also seen children who were greatly helped by the use of these medicines. They were able to focus. Their grades went up, their behavior improved. The teacher was like, it's remarkable how much better this child acts now. So when that's the case, those are children that the medicine really does help. But again, I'm not a medical physician, but my personal opinion is there are far too many children taking these medications at a young age. But you'll have to make up your mind on that yourself. Some of the behavioral supports that might be used in a school are, you can have a teaching assistant, and again, that might be parent volunteers, someone who works with the child. Having a buddy, a friend, who is very agreeable and wants to sit and help this child. So, hey, remember we're on page 23 now, turn the page. Or, she said get your markers out, get them out now, get ready to write. Or whatever it is that's coming up next. It's fine to give children some kind of a reward time for doing something well or for decreasing inappropriate behaviors, but I would avoid too much in the way of giving candy, sugar and that kind of thing in the candy, or too many toys. Children may respond, though, to the reward of something simple, as I mentioned earlier, eating lunch with someone different at the school, someone they like or admire. And on slide 14, look at that funny word forming there. Patience. Takes a lot of patience to help children with ADD and ADHD improve behavior to the extent that they can participate well in class, reduce any behaviors where they're too active or distracting to others, and so the child can be successful in school. Thanks for listening today. Hope you enjoyed this one.